Rabies is one of the most neglected tropical diseases, predominantly affecting the poor and vulnerable people in remote rural locations. According to health experts, human beings get infected by direct contact through biting, scratching, or licking of wounded skin of rabies-infected animals. Many times, these animals may include dogs, raccoons, skunks, bats, jackals, and foxes. According to Dr. Stephen Lukwago, a veterinarian at Vetpo Animal Clinic, animals infected with rabies present different signs that should not be ignored.
For all animals, signs of rabies definitely present with neurological symptoms which include aggression, incoordination, paralysis, and others.
Dr. Lukwago says rabies is very common in Uganda and that they report cases every year. As a way to curb the spread of rabies in animals, Dr. Lukwago advises that all domestic dogs should be vaccinated as well as controlling their birth.
Rabies can be prevented by making sure that all domestic dogs and cats are vaccinated against the disease, and the vaccine is given free of charge by government. We recommend that a dog and a cat is vaccinated against rabies at least once a year.
According to Dr. Rosenaine Mbabazi, a medical officer at Jaro Hospital, people who are infected with rabies present symptoms like flu, headache, and fever. She adds that rabies spread to the system of the body, with the neural system being its targeted place, and the symptoms at this stage take 7 days to manifest.
The quick onset of the neural signs or the rabies, depends on how far the point of bite is to the head. You start to develop forgetfulness. That means that the disease has gone to the brain. Some people start hallucinating. Hallucination is like you're separate from the real world. You're seeing things that are not there.
Today, over 90% of rabies deaths are in Africa, Asia, and the Middle East, where rabies is widespread. Dr. Mbabazi says, in Uganda, it's endemic and a big burden that affects public health.
In Uganda, every year we have like 948 people suffering from rabies or rabies at-risk patients. Those are bitten by dogs. Then we lose around 480 people per year to rabies disease. If you've gotten it and you've not vaccinated, prevented the disease from progressing, you will die.
Rabies is prevented by an anti-rabies vaccine, and once clinical symptoms appear, rabies is usually 100% fatal. Experts recommend that once a person is bitten by an infected animal with rabies, that person must take 5 doses of the anti-rabies vaccination and ensure that they are complete so that the body builds full immunity against the virus. Sharon Twebaze, CTV, PM Edition.